The views expressed on the following program are not necessarily those of WPSL. However, you're encouraged to like and share them on social media. It's time for the Sue-Ellensanders Show with Sue-Ellensanders.
Welcome to the show, and I can't believe we're nearing the end of this year. Can you?
Wow.
Where did it go? I stopped at the library on the way here to renew one of the books, and she gave me a date in January that it's due. January 2019? What?
That's next year.
I
A
know.
library book that you don't have to give back until next year?
Yeah, do you know how close we are to 2020?
Wow.
That's amazing.
Mm-hmm.
Yeah.
Yeah, it really is amazing.
I just
Time flies.
What is doubly amazing is that time flies and the years are blending together, and we're all still the same age.
Well,
We
see,
are.
we're having too much
Younger.
fun. Too much fun is what it is.
Is it?
Yeah, time flies when you're having fun.
My guest today is my good friend Stefanie Myers, and she is here as the Health Promotion Coordinator with the St. Lucie County Health Department and the Healthy St. Lucie program.
I am. Yes, it's wonderful.
And it is just total coincidence that I am wearing a holiday scarf and Stefanie is wearing a holiday sweater. We're just that type of person, okay?
Because we have clothes that we can only wear for about 2 weeks out of the
And
year.
darn it, we're going to wear them.
are.
Exactly. And plus, you get a bonus because this is our second cold front. A lot of times we take our Christmas and holiday sweaters, and it's difficult to get a chance to wear them because it's so hot out
It is.
that you're going to sweat if you wear them. One year I bought all of our family dogs, my son's dog, my daughter's dog, and my dog, holiday sweaters. And
Were they ugly holiday sweaters?
yeah, they weren't really ugly, but they were cute, and they were all matching. And the idea was to get a picture of all of them together, and we did get a picture of all of them together. But I'm telling you, when they were all together, it was probably 89 degrees out, and
Oh, Lord.
you weren't stopping me. I was putting a sweater on each one of those furry pets, and we haven't been able to replicate it because we can't get a year later all three dogs aren't going to be together. But even when they are together, occasionally they don't all want to sit on the couch together. So I didn't realize what a miracle it was that I got the three dogs as the holiday sweaters. But yes, I did. I'll pick it up. Anyhow, we'll get to our healthy
St. Lucie.
St. Lucie because we are going to try to be healthy. We have a few weeks, barely, not even a few weeks left till Christmas, and then we've got New Year's right around the corner. Hanukkah's already over, and we've got most of our food eating holidays
Yes.
still to come. So I'm hoping that everybody's walking and running and biking and being healthy to counteract, because certainly we're not going to stop eating.
No. There's just no way, especially not around the holidays. There's too many goodies out there.
And it's almost the same as the holiday sweaters. You have holiday cookies, you have holiday treats, things that are made only at the holidays, and you can't turn them away any more than you can shove those holiday sweaters to the back of your closet.
No, you can't. And fruitcake is my weakness. I know everybody thinks.
Really?
Yes, I love fruitcake. Especially the Chris Adams has a homemade recipe.
Well,
It's
Chris
fabulous.
Adams fruitcake doesn't taste like the fruitcake that my grandmother used to make, which could have been used for door stops.
People swear that the fruitcake
God
never
bless
gets eaten.
her.
They just pass it around from year to year.
Yeah,
But
yeah, the same. But yeah, I do like Chris Adams fruitcake. And, she'll probably, we were going to do like a little promo for next week having Heathcote on. And she was on the board and president of the board of Heathcote for so many years that I know that when I visit the Garden of Lights during the holiday season, the chances are good that she'll still be there.
Yes, she is still there. And as you know, I'm a gardener
Yes.
in my spare time. Ha ha.
Mhm.
And Heathcote has been one of the places that I will go and do a lot of
Really?
work of love. Yes.
I didn't know that you
Oh, yeah.
went there.
Yeah.
And
And one of the things that was really neat is they actually just sponsored one of the mini challenges that we do as part of the Billion Step Challenge.
And people forget that gardening is exercise too.
Absolutely, it is. And we're talking a little bit about the Billion Step Challenge, but what this is an initiative that we started back in January with the goal of trying to get people in the community to move more. We have high sedentary rates, means that adults who feel like they don't get enough activity, they consider themselves to be sedentary, we're higher than the state average.
Mm-hmm.
And so one of our initiatives was, hey, let's get people moving more and let's make it fun. Let's make it a healthy initiative. There's a little competition going on. Well, after a year of this, people are like, yeah, I need to get my steps in. So we started doing these mini step challenges. And that was something internally. They ran for 2 weeks. And we got sponsors to help really highlight some of the other supporters of this initiative. And Heathcote was one of them. We used it as a lead into their Garden of Lights, which it sounds like you're going to be speaking with them next week.
Yes.
Wonderful.
And I, for the first time in a long time, I am back working in an office environment with the most wonderful work family ever possible at the Early Learning
But you're finding
Coalition.
yourself not moving as much, aren't you?
But I am finding myself like today, I didn't leave my desk because I was working on a project on the computer. And after about 5 hours, when I went to get up from my desk, my knees creaked. And it was like I was walking awkwardly, like I was. And we already addressed this, that we are not old, that the years are going by, but our age is not growing.
Yes.
But I did feel like my age at that time was growing.
Well, the key that I've heard is that in order for us to move more as we get older, or as the world ages around us, then we need to move more. It's kind of, this concept of to move more, you got to move more. We have to keep moving. And I actually have set up my phone to beep at me every hour. It just vibrates on my desk to remind me that I need to get up and move around.
Mine
really
does
helps.
too, but I'm really good at ignoring it. It's funny because when you're sitting with somebody else who's doing the Healthy St. Lucie Challenge, when you're sitting there at lunchtime and both of your watches or your phones beep at the same time.
Yes. Absolutely.
It's like, okay, we're eating lunch, but we have to get up and move because...
That's where you stand up and you have a standing lunch.
Yeah. For a while it was almost a joke about it, but I really wouldn't mind having one of those desks that was high enough up where I could walk while I was doing.
They actually have walking desks where they actually has a treadmill attached to it, and then they also have standing desks that are adjustable height.
I've seen those, and one of my daughter's roommates actually has that at her workstation. And the adjustable desk allows you, to do whatever you need, but they also have like different things that you could order to be doing, like speaking of stepping, the stepping thing. What's
Oh,
it
really?
called? Yeah.
Yeah, the stepper.
Stepper,
Yeah,
thank
the
you.
stepper.
Yeah.
Or
the little
elliptical's the other one. I
stepper.
don't know if they
Yeah.
have anything for the elliptical, but
The elliptical would be tough because you're supposed to like move your whole body and your arms too. And I think that would, that would be great. You'd be sitting at your desk doing that, but you wouldn't get anything else done.
no, you have to tie it into something that would generate electricity, so at least you're contributing, right?
I do make a point of parking my car far away from the office door.
Good.
And I do know, and today was a really good example for me of why maybe once every 2 hours, I just have to get up, save my work, and walk around the building, or walk around instead of emailing somebody. Go to their office door or go to their cubby and talk to them.
I've actually had some people say they will print out an email and then walk it over to the person.
No, that's a little. Don't you think that's a little over the top?
Well, if it gets you up and gets you moving more,
but
it makes people take a break so that they're able to be better focused when they're done.
Yeah, and it's true, because then you have to. If you don't have a printer at your desk, then you have to walk to the printer, and then you walk to the person.
Yeah, exactly.
So all those steps add up.
Well, I will tell you that with this initiative, we have walked to the moon and back.
Have we really?
We as a community have already walked to the moon and back.
In St. Lucie County.
In St. Lucie County.
Yes.
We've walked to the moon and back. It's astounding to me to look at it from that perspective. Right now, we are at about 870 million steps, and we've got a couple weeks left in this year. So we are really encouraging people to stay active, not just for the Billion Step Challenge, but also so they can stay healthier. This is also, and some people may be aware of this is what they call the quit season. This is as people are moving into the new year, they decide that I'm going to quit smoking. And what we've found is that when people are in the process of that when that first withdrawal really hits, it's just tough to stay on that wagon and be able to avoid using cigarettes. Well, guess what? Exercise helps combat those withdrawal symptoms.
Unless you take the cigarettes with you on your walk.
Yes, that would be problematic, yes.
But
so it's really, 'tis the season. As you're looking at making some of those life changes, it's a wonderful time to sign up and to be able to have some accountability. If you are able to form a team or join a team, you've got people around you who are going to help you, stay on that right track to keep you moving more. Makes a difference.
Some of my best friends have been formed running and walking, because when you're out and you're exercising and you're away from the TV and maybe away from your phone, or
without distractions, so to speak. Yeah.
You have to kind of concentrate on each other, and whether you're training for a race or just going out for a stroll after dinner. It's also the other thing that we've been doing in our family a lot when we're walking, is listening to books on tape.
Yes.
And so we're not, though we may not be socializing as much, we are learning a lot. And the library here has a tremendous selection of audiobooks that you can check out through the app.
That if you're willing to, if you have a tablet or something that you can.
Oh,
read
sure.
from. But I admit I'm an audiobook file. If that makes any sense.
Well, the thing is, once you go audiobook, it's hard to go back to the reading, especially if you're moving around. Cliff is laughing at us. We're nerds. Are we not nerds?
Absolutely.
We like being nerds.
We're two peas in a pod. So, it's not like when you talk about being healthy and the different types of exercise, not all of it has to be deliberate. Some of it can be accidental exercise. You were a gardener before you cared about your steps.
And what's really nice about the initiative that we're doing now, the application we use is called Walker Tracker. And part of the reason we selected Walker Tracker was because people can enter activities. So if somebody doesn't have a device that they're using, like a Fitbit or an iWatch, they can actually just go into the app and enter the amount of time they spent gardening, and it will convert it into steps for them. I have somebody who doesn't wear a watch when they're bowling because they find it distracting. But if he puts down that he bowled for an hour, well, that converts into steps, and he can enter that directly into the application.
So every time you get up to bowl, it doesn't seem like it would be a tremendous amount of steps, but I guess it adds up.
It does. It does add up. And when you're entering that activity in, the system adjusts for what is appropriate.
Oh, they figured it out.
Yes, they have.
Housework. Yes. And mowing the lawn.
Housekeeping is actually another one on there. And I got to tell you, with mowing the lawn, I like to get my actual count of steps. So I actually wear my watch when I do
my
that,
husband
so.
does too. And on the days that he mows the lawn, he always beats me in steps. And he makes it a deliberate thing to take extra steps.
Of course.
Yeah. But there's a lot of different things like that you can add to your tracking.
And people who join, they can actually get hints that pop up that tell them how they can expand it. One of the ways you talked about was parking your car further away. Our objective, really, in order to stay healthy and to really be preventative for future chronic diseases such as diabetes and heart disease, you need to hit about 10,000 steps a day. Okay, that's really your goal to stay healthy. And if you can build in those extra steps, anyway, instead of taking the elevator, I'll take the stairs. And those little things can really impact what you're doing. If I need to get something printed and I need to walk to the printer, I'll print one thing and then go back to my office, and then I'll print whatever the next thing is, and I'll go pick it up and then bring it back. Little things like that make a difference.
You also, we're in the season for shopping.
Yes.
Where people are going to stores, whether you're going to local stores and walking up and down the streets of downtown Fort Pierce, or you're going to department stores and walking up and down the aisles, you get steps that you don't even really think about. Have you ever gone to like a big store like Sam's or Target or something, and
looking for something and hunting,
and so you just go everywhere, you go up and down every aisle, and the amount of steps that you can get on that is really incredible.
Well, and the thing that people need to remember, because I've got my 10,000 steps in today, that means I get to go eat X, Y, or Z. Well, oftentimes, especially around the holidays, what we eat is not able to be worked off in 10,000 steps.
Yeah.
But the joy is if you put in more than 10,000, then it does help offset some of that, so you're not going to end up with the holiday weight gain.
Well, and if you stay right on top of it, and I'm not one of those people who feels, I was going to say I'm not one of those people who feels that they should weigh themselves every morning, but I honestly am. But
it's just between you and I.
I know. Yeah, nobody's heard that.
No. Okay.
But when I do see, and it doesn't show up the next day, of course. I used to think if I had like a big ice cream sundae and a hamburger with fries, that when I stepped on the scale the next day, it would show it, but it doesn't. It usually shows it a couple days later. But when you see it, rather than wait till you have 20 pounds that you have to lose, if you see it start to jump up 3 or 4 pounds, that's probably the time to,
Well, and if you're
walk
proactive about
extra
it and get those extra steps in, then you may not have that same impact. And it really does make a difference. I mean, somebody told me once, the only way to lose weight is to burn more calories than you take in. So you either got to decrease what you're eating or you got to increase your activity.
Well, I had a friend who is a dietitian too, because I've always been a long distance runner, and I've put in a lot of miles, and I've always been somebody who eats to run, not
absolutely
runs to yeah.
Instead of running to eat.
Yes. And lately I've found myself in a reverse situation where, because I'm not running as much, because I've got a bad knee, but I'm still eating the same things that I ate when I was doing a long run.
During this time of year, I don't necessarily make good, healthy choices. I'd much rather have that piece of pie than eating my 5 servings of fruits and vegetables every day.
Well, as long as it's cherry pie.
Oh, yours is cherry. Okay.
Yeah, and cherry pie, and then, what can you do? Is rhubarb a fruit or vegetable? Is that fruit too?
I think rhubarb is a fruit, but do you know how people down here in the South don't have any idea what rhubarb is? My husband actually bought some the other day at the farmer's market, and somebody goes, "You must be from the north." But he loves strawberry rhubarb pie.
I don't really know what rhubarb is, but I do like the strawberry rhubarb pie because it makes the strawberry a little tangier.
Yes.
So what is rhubarb?
It is, I believe that it is classified as a fruit. It kind of grows like celery does. So it comes up in those stalks.
See, that's it. I think I've seen it in the store, and that's
Yep.
why I thought it was a vegetable, because it's
Yeah.
stalky looking.
And good, filled with high fiber, lots of vitamin C.
Oh, so it's good.
It is very
It's
good. For you.
good.
Now it's the sugar in the pie that gets us in the end. But
Oh,
we won't.
yeah.
You know, we won't go there.
we don't need to even address that. And you make choices, so if you want to have mashed potatoes at every meal, then maybe you cut back on dessert. Whatever.
Portion
There's
size
a lot
is
of
another big issue
yeah.
with that. So. Well, I know we've gotten off the topic here.
Yeah, we did,
I know.
but
How
it was
unusual for
food,
us,
and
right?
how hungry are you now, right?
Exactly.
So, Healthy St. Lucie, you have different challenges that are going on, and you had sponsors who challenged you for different
Supported
events.
us for
Yeah.
to increase some of that competition and bring a little bit of something new and different.
Okay.
Community.
What else do you have going on? I know that you are as busy as a bee.
I am, and granted, while my focus right now is looking at health, part of that is because we are getting ready to do the next community health needs assessment. All of the initiatives we're putting together have created the community health improvement plan. We call it the CHIP, so I try not to use too many acronyms, and it runs for 3 to 5 years. So we're getting ready to do the next assessment to look at where are we going to go from here, and what are our next needs, or what is our next improvement plan going to look like. So we actually have meetings. We meet the second Thursday of every month at the Milner Health Department office, which is 5150 Milner, from 3 to 4:30, to talk about, what are the needs we've identified, how are we doing with the initiatives that we currently have in place, and really getting a sense of what do we need to be focusing on for the next few years.
Is the public then? I mean, you gave the time and the place
did.
and everything. Are they invited to the meetings?
It is a community health improvement plan, so we want to
Okay.
have people, and the more hands make light work. So the more people we have involved that are willing to help us work and to implement the strategies we have, the more likely we are to be successful.
This could be a drinking game. How many cliches that you and I can use? No, I'm not.
sure
I'm
we only
not
do it
saying
with water
any.
though, because it's better for
Yes,
us.
yes,
Yes,
to
we
do
do.
it with water. Of course, that's what I meant. Yeah, but I'm just saying between the
She's
two
turning
of
red,
us
you guys.
and
You can't use
our
it.
idioms and our
I
cliches
know.
today.
Yeah, I don't know why. It is what it is.
Once we start, it's hard to stop.
Oh Lord.
So, but people, it is a community action plan, and people can give their input. And who are you expecting to come and give input? I mean, what type of people are you
as we
encouraging?
get into the community health needs assessment, we'll actually be going out into the community. We want to talk to people. We'll be doing focus groups. We'll be doing some surveys out there, and we're going to be encouraging people to reach out to us and say, hey, I've noticed that I have a lot of people with disabilities or seniors who live on my street, and they struggle to get out and about. So let's look at what are the reasons that they struggle, and is there something that we can do as a community to help address those needs? That actually leads into, I use that example, 'cause first thing that came to my head, but we are also having a meeting tomorrow from 1 to 2:30. It's our very first meeting, to look at what can we do to make our community more age-friendly. I know we just talked about we don't age, but we do have challenges that come up, whether that be we're not as balanced as
Now,
we used
remember,
to be.
this show is running on Friday. So, will
Yeah,
this meeting already
This
have
meeting
taken?
happens.
Okay.
This meeting happens every second Thursday from 1 to 2:30.
Thank you.
So that
Yeah.
we'll make sure that we
Yeah.
put that out there
Yes.
as well. And so we're going to be doing, again, part of that community health and needs assessment is looking at what can we do to help our community be more accessible. Seniors often talk about having social isolation issues. They don't have the transportation, or they can't go out and maybe walk in a park like they used to because they're using a walker and they're afraid of falling. So looking at what are some strategies that we can utilize and we can put into place to make it so that they can be less socially isolated. So lots of cool stuff coming down the pike. Anybody in the community can come and participate in those. And even if somebody is like a homeowners association member and they want to bring back and start a walking group in their community, we encourage them to come. We'll help you develop strategies.
That's what I was
and
going
give
to
you
ask. How
information.
can you help? But you
Mhm.
can come up with strategies and
Yep.
get them all
if you are
signed
a member of
up.
a church, you can go out and you can talk about the importance of prenatal care. It's one of the areas we have is challenging as infant mortality differences between cultures in this community are pretty significant. So let's get some spokespeople out there to talk about the importance of diabetes education and chronic disease management and, prenatal care and nutrition. It's that ripple effect. If we can teach one person and they can go out and teach another person and so on, we can change the world. We could change the world.
Even just getting to the step where you read the back of the boxes when you use it, and as you said, portion control. You don't have to leave off when it comes to food and nutrition. You don't have to leave off the things you like.
Exactly.
You just have to control the portions. But as far as education, there are a lot of people. I heard a parent the other day bragging that they didn't have to go to the doctor until they were like 8 months pregnant, and they didn't go at all, and they were like, proud of themselves that they didn't do that. And there are so many issues with that.
But, if they're not getting adequate nutrition, they're not on taking vitamins, you can end up with birth defects that are inadvertent. They find that moms who don't get good prenatal care sometimes are more likely to have premature births. And just being able to monitor what's going on with that infant can really have a significant impact.
In today's healthcare too, there are a lot of issues that can be dealt with if you know about them up front.
Well, even my guess is if that person's not getting prenatal care, they may not be involved with the Women, Infant, Children program, which helps them get nutritious food, not just when their child is born, but prior to that. And being able to make sure that the nutrition is in place. The other thing we found, we talk about childhood obesity. It's another one of those challenges in our community. And increasing breastfeeding leads to children being less likely to be overweight when they get older. So one of our initiatives has been being able to encourage people, because breastfeeding, I'm not a mom, so I've never tried to do that, but from what I understand, it can be challenging.
Yeah. It's funny because I had 2 kids, and the first child didn't really click with the whole breastfeeding thing, and we lasted for almost a month breastfeeding, and it was a struggle the whole time. And this is the young man who grew up and was a picky eater as a child too.
I'm not sure there's correlation there, but there may
There
be.
is absolutely a correlation,
Okay.
and I'll tell you what it is. And then my daughter came along 15 months later, and she started breastfeeding like she was born to it, like she had trained to do it. She was a champ at it. And so through my milk, she tasted all sorts of food.
Okay, yeah. That makes
And
sense.
so she was exposed to way more kinds of food over the 1 year than he was. And so she was not a picky eater. And what that turned into is she, in general, became a healthier eater because there were more options that she had to choose from.
Well, it's interesting that your first child struggled with that process. Well, one of the reasons that people will sometimes not breastfeed is because they got to work.
Yeah.
Or they don't learn enough, and it's not part of what their experience has been growing up, is that women breastfed. So we actually have an initiative that's going on with the hospitals locally. They're called baby-friendly hospitals, and they are working to provide education to these moms before they ever leave the hospital. We have pediatricians that are making sure that they're providing that same education. The messaging is the same. And we're working with employers right now so that they understand what the expectation is for them to provide the ability for moms to breastfeed, whether it be to pump milk, do those kinds of things.
Well, and it's been quite a while since my kids were babies, I will admit. But even back then, as I went back to work with both children, you don't have to breastfeed 100% of the time for your child to get the benefits of breastfeeding. So, if you're breastfeeding in the morning and then you pump in the afternoon, or you just wait till you get home and breastfeed, and then at night before they go to bed, you breastfeed, then they're still getting a lot of the breast milk. So what we were having a conversation the other day. I was blessed to be able to have dinner with two young friends. One who has a 6-month-old baby, who's just the cutest baby you have ever seen. So he's squishy. He's like that perfect weight where there's a little bit of chub, but not too much.
What we used to call a Gerber baby.
Yes.
Yes.
And the other one is due in 3 weeks.
Oh, wow.
So we were looking at, talking about comparisons. And so the conversation got around to breastfeeding. And I can tell you how comfortable the husbands were to be a part of that
I'll
conversation. Yes. So we're talking about what is the recommended age that women breastfeed to. Do you know that?
I don't know the date off the top of my head. I can tell you they recommend at least 6 months.
Mm-hmm.
And I have known people who have nursed up to 2 years. So it just depends on the degree of comfort. And some of it depends on, what works for the mom. If she's trying to work, if she's, how does all that work out? But they recommend at least 6 months. You'll end up with a child who's less likely to gain weight excessively and who also tends to be healthier. They have a better immune system than otherwise. So,
yeah, and the colostrum, which is the very beginning of the milk. That's
people are going to be turning us off because we're talking about breastfeeding.
Okay, all right, yeah, it's kind of like we did with my husband and the other husbands at dinner. So yeah. So anyhow, I was just curious. So don't turn us off. We'll talk about some man-friendly stuff too.
Well, interesting, and I know that I'm not with this organization, but it plays right into that health message that we're trying to get out there. Moores Creek has a health and wellness fair that's coming up. It'll be on December 22nd at the corner of 8th and D. This is sponsored by two of the local Panhellenic group, which is Phi Beta Sigma and then Zeta Phi Beta. They are working to bring people out for early diagnosis. They'll be testing for blood sugar and blood pressure. They're going to be doing food demonstrations. They're going to have fun activities for kids. So just another way for people to get engaged, come out and learn some new things, and have a little fun while they're doing it. So.
That's awesome. And that's December 22nd at Moores Creek.
Yep, from 10 to 2.
From 10 to 2. Okay. What else do you have coming up?
We
almost
have
said coming down the pike, but I'm trying to be
we're
cautious.
trying to get away from our cliches,
yeah,
are we?
Yeah.
We have, we're getting ready to wrap up this Billion Step Challenge. Well, we're going to be doing next year as well. So 2019, we have a Fit Festival. We kicked off the year last year with a Fit Festival. It'll be at the Port St. Lucie Civic Center. Fit Fixins, who does healthy food in the community,
and their food is awesome.
Oh, and they bring it to your home so that it's that prepackaged thing. But he's all about the nutrition.
He is, and as a matter of fact, we tried it. We had a coupon to try it for a week, and it was just delicious.
Well, he's one of our sponsors.
Is he?
Yeah, he is.
Yeah.
He's one of the
Tiger
sponsors for us.
started
Clyde
his own
Tiger.
business.
Yep,
Yeah,
Clyde Tiger, yep.
Mr. Tiger. Yeah.
Yeah, he did a great job.
Yeah.
With getting that out there. So he's going to be doing the Fit Festival again. And we just want to bring exposure to all kinds of health and fitness businesses on the Treasure Coast. And we're using that as our opportunity to kick off and really encourage people to participate and talk about, moving more and getting up to those 10,000 steps a day.
So when is the Fit Festival?
It's going to be January 19th. Okay, everybody's going to groan, but it starts promptly at 7 a.m., okay, with a 5K walk. So they're really going to, get people to engage and be a part of that 5K. But we're also going to have all kinds of other activities. We will have bounce houses and kids events that are going on. We're going to have fitness demonstrations. There will be some health testing that's available there. Not sure exactly what that looks like because I haven't talked to him recently. There are going to be presentations on health and wellness.
Where is there?
This is going to be at the Civic Center. It is, and I'm smart enough. I did write down the address before I came in. It's 9221 Southeast Civic Center Place, which is in Port St. Lucie.
Yes, so it's the Port St. Lucie Civic
Correct.
Center.
Yes.
Because the Fort Pierce Civic Center is no longer called the Civic Center. It's now the Fenn Center.
Correct.
Yeah. So
Yes.
the Civic Center.
You've been around enough. You actually remember the old
Yes.
Civic Center. So do I.
So the Civic Center that's at the corner of Walton Road and US 1 is
Correct.
the one that we're talking about. Not to be also confused with the Community Center for Port St. Lucie, which is over on Arosa. We're talking about the Port St. Lucie Civic Center, which is at Walton, the corner of Walton and US 1.
Correct. Yep.
And it's going to be indoor and outdoor?
It will. They're going to have 25 different interactive booths. They will have food vendors that are there, so you can come on and have some fun with that. We're expecting between about 1,000 to 1,200 different people coming. So it should be a real fun event, lots of activity. And in January, it shouldn't be too hot.
No. So the 5K is connected to that?
Yes. Clyde is working with the whole Fit Festival coordination team to get us a 5K. If people have questions about what's happening with the Fit Festival, they can call 772-405-7805. It will be a timed race, so for people out there who are big runners who want to make sure that they can get qualified for things, they are encouraged to apply. And I'm not sure if they've got the website back. Yep, they do. It's tcfitfest.com for more
Okay.
information.
Or you can Google TC Fit Fest if you can't remember all that, or you can call here during the workday, and Lynette will give you the information. There are a number of other races that are coming up that weekend. Actually, there's the breast cancer walk, some kind of breast cancer walk that's also going on, and then the Run for the Coach that's over
that's
at
right.
Riverwalk is that day too. And the next day on Sunday, I believe the 20th, is the Lions Club half marathon.
Oh, okay.
So there's a lot
that
of
came up
things that you
fast.
can be you can be ready for. And then of course the Bridge Buster race is coming up the first Saturday in January. So if you want to get
I think it's important people to know
inspired.
you don't have to be a 5K runner to do this.
No,
We have folks who
no.
come out and push the stroller.
yes.
Just come out and participate and enjoy some of what's going on in our world.
And honestly, the camaraderie that goes on when you're walking or you're running or you're jogging or you're pushing strollers, it's really awesome. And you're setting, if you have young kids, you're setting a great example for those kids. Kids, I think, who grow up being pushed outside in a stroller or in a running stroller or walking alongside mom or dad are more likely to imitate them as they get older.
To move more.
Yeah.
They'd be more active than otherwise. Kids don't live by what we say, they live by what we do.
So get off
Oh, no,
the
another
couch.
cliche.
Now that's more of a saying, I
Okay,
think,
okay.
than a cliche. A cliche is overused. That one I don't believe is used enough.
Okay, fair enough.
Wearing my English teacher hat, which is almost retired. But there are a lot of awesome ways to stay healthy in 2019.
Yes, there are. And we hope everybody will join in and find out more. If you're not sure what that looks like, well, there are resources out there that can help you. You can go to the healthystlucie.org page, and all kinds of connections and resources there that you can look at. We are actually really encouraging people to sign up now for the new year. They go to healthystlucie.walkertracker.com, or they can go to the healthystlucie.org website
And find the link.
to
there.
it.
Walker Tracker is the link.
We rolled out a contest today, which is for our existing participants to
That's
see.
me.
That's the
Yeah,
reason I'm bringing
yeah.
it up.
Okay.
Okay. To encourage them we have a referral contest going on. Okay. So the person that gets the most people signed up and active, so they're actually showing.
What
that
do I
they're
get?
moving.
What do I get?
I'm not telling you. It's $100 value. Okay.
Oh, okay.
For people who want to enroll in this. They just need to go to the website. Okay, you can invite people from within the application itself. If you're like me, you want people to be successful at it, so I sit with them in their phone and I help them download the application and register. But the person who gets the most actively involved runners in preparation for our new year, they're going to end up with a $100 value gift. It's exciting.
So we don't know what it is yet.
No. I've got
'cause
sponsors who are taking care of it.
I was hoping for a gift certificate for Fit Fixings.
You don't know. There might be something in
Yeah,
there
it
from
could
that.
be. It absolutely could
Did
be.
I mention he's one of our sponsors?
Yeah, you did. Chicken sausage. Let me just say, chicken
really?
sausage
Okay.
is awesome. I think there's a chicken sausage dish with orzo. That
Ooh, that
yeah,
sounds
just
really good.
thinking about it, it's really tough doing a show where we're talking about food,
Yes.
isn't it?
We're going to be drinking lots of water so that we don't go out of here and eat.
Well, Stefanie Myers has been my guest, and she is the health promotion coordinator. And, honestly, Stephanie, next time you come here, you're going to have to bring food with you.
Fair enough.
Yeah.
As long as I can make it sure it's healthy.
Oh yeah. We'll do some sampling of healthy food.
All right. I think Cliff will like that too.
Yeah, I think so. And she is with the St. Lucie County Health Department, and you can contact them. You can go on their website to sign up for the Walker Tracker. If you are looking up the application on your application store, what is it called?
It's called Walker Tracker.
Okay.
But the easy way to remember it is an orange square with a sticker in it, a tennis shoe in it.
Okay.
So it's real easy to find when you go in and look at your app.
So that and so you could download the app and start using it, but remember then you have to have your phone with you, or so many people have Fitbits or smartwatches. I think that all together we can get them organized. You've been listening to the Sue Ellen Sanders Show. I promise that we're going to be fit for 2019. We're going to spend the rest of the year eating strawberry rhubarb pie and walking it off.
I love it.
Stefanie Myers, again, has been my guest, and she's the Health Promotion Coordinator for St. Lucie County Health Department. Thanks for listening today. We'll see you next time with more.
The Sue Ellen Sanders Show, Friday nights at 6:05, just before we get into sports, right here on WPSL.